My name is Dan Jones. I'm the director of the bariatric program at Beth Deaconess Medical Center, and I'm also associate professor at Harvard Medical School. This is our first time to sort of reach out to folks on YouTube, and what we'd like to do is expose people to some of the procedures that are being done for weight loss surgery. Obesity right now in the United States is an epidemic. A third of Americans are overweight. A fifth of Americans have morbid obesity. It's an epidemic both for our children as well as our adult populations. And unfortunately, diets don't work for the vast majority of folks. So what we have at Beth Deaconess Medical Center is a bariatric program. And what that is a group of doctors, surgeons, nurses, dietitians all working together to help patients lose weight. Many times patients have lost weight in the past only to regain it, and we understand the physiology of why that happens. For most folks, especially if you're over 100 pounds overweight, surgery is probably your best option. But before you make that kind of decision, you need to know the risks, benefits, and alternatives to surgery. We'll give you a little bit of the information here on YouTube, but invite you to come to our bariatric seminars to learn more and to see if weight loss surgery is right for you. When we talk about being overweight, the way that's calculated is with the body mass index. And what the body mass index does is it looks at your height relative, your weight relative to your height. And with that you get a number. And we can calculate that on any number of the websites, or you can come to our website or information session and we'll help you calculate it. But basically, if your BMI is greater than 30, you're overweight. If your BMI is greater than 35 or 40, now we're talking about folks who may want to consider a surgical option. The National Institute of Health says that if your BMI is 40, you have medical necessity for a surgical weight loss surgery. If your BMI is 30, you're going to need some other sort of medical condition. Obstructive sleep apnea, hypertension, type 2 diabetes. In fact, there's a whole lot of conditions that go along with being overweight, including the type 2 diabetes, the hypertension. You can have leg swelling, shortness of breath, infertility. You might have problems with bad reflux, heartburn. A lot of conditions that go along with being overweight. Back pain, knee pain, cancer even. The good news is if we get the weight off, no matter how that's done, many of these conditions either get better or go away altogether. So it's not uncommon for folks to be on a lot of medicine preoperatively, and with the program of diet, exercise, and weight loss surgery, get off the vast majority of those medicines. Now again, we said surgery is not for everyone, and before you can actually be offered a weight loss operation, you've got to really understand the risks, benefits, and alternatives. You'll come into a program like ours, you'll see our nutritionist, our bariatrician. This is an internal medicine doctor who focuses on the issues of being overweight, our psychologists, social workers, surgeons, the whole team before we can see if you're right for surgery and whether the operation is going to meet your expectations. While there's a lot of different operations out there that have been done to try to lose weight over the decades, at our program we offer two procedures, and it's the gastric bypass procedure and it's the laparoscopic adjustable band. So let's talk about the band operation first. This is the newest player out there, and what it is essentially is a belt, and it goes around the top of the stomach. You can see it right here. The belt goes around the top of the stomach, and it has a balloon on the inside. So as you put fluid, sterile water, into this port, it tightens up the balloon and puts basically a chokehold on the top of the stomach. If it needs to be loosened, you can take fluid out of the port. Now these are ports that are used in other issues that patients may have, say for chemotherapy and things like that. And the unique feature here is you can put a needle in without popping the port. It goes underneath the skin, it's buried. And with this, what happens is you're usually just not hungry, and after a few bites you're full, so you eat less calories. If you combine that with exercise and burn off more calories, you can see how you lose weight. So it's not a quick fix, but it's a tool that folks can use to successfully lose a lot of weight. Now, You can beat the procedure by drinking a lot of high-calorie milkshakes that would go right through, or candy and things like that, or alcohol. But for the vast majority of patients, they can lose a significant amount of their weight. The other operation is the gastric bypass procedure. In this operation, what we do is we divide the stomach and make a very small pouch. The pouch may be as small as just your thumb, a very small stomach. Again, we try to achieve, at least for a little while, the sense of satiety, not being hungry. In addition, after a few bites, you want to have a sensation of being full to where you start to learn to eat smaller portions. In addition, because we cut the bowel and bring it up, we have a piece of bowel that comes up and connects. It used to be further down in the GI tract, and that's called the roux limb. This piece of bowel doesn't tolerate sweets and fatty foods, and therefore if you eat them you feel really crummy. You might have sweats and chills, you might have diarrhea and vomiting, you might just feel miserable. And therefore what you do is you learn not to eat these high-calorie sweets and fatty foods, or better yet, you avoid them together. Again, by avoiding those high-calorie foods because you just won't feel well with them, again, you decrease your calories, combine that with exercise and eating healthy foods, and you lose a substantial amount of weight. So how much weight might one lose? Well, with the band, we talk about people losing 35 to 70% of their weight, a very wide range. You could gain weight if you ate all the wrong foods, but again, in a good bariatric program, we really expect to lose half of your extra weight. So if you're 100 pounds overweight and you stick with the program, we'd expect you to lose half of your extra weight. You can lose more, and a lot of patients do, but we give you average numbers. With a gastric bypass, we'd expect you to lose 50 to 70% of your excess weight. Again, you can achieve just as much weight loss with the band, but more patients are going to do better with the gastric bypass simply because you have that dumping effect, that behavioral reinforcement to say avoid the sugars and avoid the high fatty foods. The patients who do better will really comply and integrate diet as well as exercise into their new lifestyle. And patients who try to beat the system can. Now, with any operation, there's also risk, and so weight loss surgery should not be taken lightly. You can die from an operation, and therefore we don't want to say this is a quick fix for anyone, but it needs to be considered as a thoughtful plan for how to reduce your lifetime risk of dying of heart attack and stroke or clots in the legs. We'd like to invite you to our program. We'll provide you with the dates for the upcoming sessions that we have. We invite you to meet with us and bring your questions. Log on to the internet, learn all you can, learn about how people's lives have been changed and their quality of life has been improved, but also ask about complications and whether people would do one of these operations again. Ask your friends and family, as many of them may have also had these procedures or know people that have had them. Look forward to meeting you and introducing you to some of my colleagues and learning more about this procedure.
Hi, I'm Ben Schneider. I'm one of the weight loss surgeons here at Beth Israel Deaconess Medical Center. I'm an instructor in surgery. I look forward to meeting you at one of our informational weight loss surgery meetings.
Hi, I'm June Skorpowski, one of the bariatric nutritionists here at Beth Israel Deaconess Medical Center. My partner, Kelly Boyer, and I are here to help you throughout the entire process. We'll see you before surgery and after surgery to make sure you're well educated on what you need to do to be successful in our program. And we'll also help you with healthy eating. So we look forward to meeting you.
Hi, my name is Amanda, and I'm one of the first people you'll meet here in bariatric surgery in the Shapiro building on the 3rd floor. When you call, I'll be sending you out literature. Make sure you read your literature, and I'll see you on your first appointment.
Hi, I'm Maritza. I'm the administrative coordinator of the bariatric program and work closely with Dr. Daniel Jones. If you would like further information regarding our program, please feel free to give me a call at 617-667-5101. Thank you.